It's typically a very broad base of symptoms. A lot of the times, patient present uh, and somebody describes to them they're walking funny, like they are rotating the foot inwards or they are throwing their leg outwards. Sometimes people come with pain and discomfort, especially in young adults. It can be a pain in the knee or the hip area. But more often than not, it's the deformity of the leg in the way of a rotation, which brings the patients to medical attention. So clinical examination is most important. So a person who is an expert in diagnosing these conditions would be able to examine the patient fully, both when they're walking and on the couch, and would be able to work out if there's a rotation in the shin bone or the thigh bone. Once there is a suspicion raised, either by the clinician or by the patient themselves, or by both in most cases, then we need to do some specialist tests in the form of a CT scan or the MR scan and confirm those findings of clinical examination. So that's a very relevant question and difficult to answer. In adults, it's relatively easy because it typically happens after a bony injury like a fracture, which has not been treated correctly or not been correctly fixed. In children, though, it's difficult to be sure. Sometimes, if it is only one lower leg, then it is typically because of an injury which went unnoticed, or it can be from birth as well. And those people typically have bilateral or both legs involved in this malrotation syndrome. There's also a condition which we call miserable malalignment, which means that a child had a deformity in one of the components of the lower limbs, either below the knee or above the knee, and the rest of the body tries to compensate for it and develop an opposite deformity. And they are quite difficult to treat. But these patients, if they become symptomatic, either for cosmetic reasons or their sporting activities are being affected, or they sometimes start complaining of pain, that's when they would require treatment. So non-surgical treatments are far and few in between. So they're typically changing the footwear, giving some insoles, for example. And in certain parts of the world, people try and use what's called a twister brace, which is quite drastic for something which is not symptomatic. And I've only seen patients having used it not being effective. Uh, we would normally in the United Kingdom treat them with minimal intervention like splintage. And if that works, well and good. And if that does not work, then the only effective treatment is surgical treatment in the form of a derotation osteotomy, whereby we divide the bone and realign it in a correct shape. To affect all of those three things that you mentioned, so it can affect persons walking, it can affect their difficulty to run fast, participate in certain sports, turning quickly. It can be painful as well. Typically, if it is a thigh bone which is malrotated, then the pain influences hip. And if it's the shin bone, then it influences the knee bone. It can also have a long-term effect in the form of developing osteoarthritis. The jury is still out, and the evidence is not compelling that it leads to arthritis. But anecdotally, we know that people who have malrotation of the legs will develop arthritis sooner than they would have done otherwise.